This is Edie. She's our patient. She's a previous patient here at the clinic. She's a 25-year-old female that reports to the clinic today with complaints of vaginal discharge for the last 4 days. She's alone, but she appears to be a reliable historian. Her speech is clear and understood, and she answers questions appropriately. She reports noticing a foul odor 4 days ago, with the discharge coming later in the day. She reports that the discharge is thin and watery, white in color, and it's been present daily for the last 4 days and present upon awakening. Her past medical history includes a previous diagnosis of UTI, bacterial vaginosis. She reports one pregnancy that she carried to term and vaginal delivery without complications. She reports having a tonsillectomy as a child and denies complications with that surgery as well. She denies any chronic health issues or illnesses. She reports no drug allergies, no food allergies, and no environmental allergies. She reports taking one vitamin daily, a biotin at 5,000 micrograms daily, and 1,000 milligrams of over-the-counter Tylenol every 4 hours as needed for headache pains. The review of symptoms, she denies fever, denies chills or malaise, denies headache or vision changes, denies shortness of breath or palpitations, denies changes in appetite or abdominal pain, denies muscle pain and weakness, reports vaginal discharge with a foul odor and some itching. She denies difficulty voiding, denies pain with urination, and denies any changes in her menstrual cycle. We collected an STD panel. The STD panel was negative. Did the KOH test. She was positive for bacterial vaginosis, and she had labs done at this clinic about 3 weeks ago. They were reviewed with no abnormal findings. Her physical exam, she is 65 inches tall and 110 pounds. Her BMI is 18. Blood pressure was 122/81. Heart rate 84. Respiration 16. Temp 98.6. And her oxygen was 99% on room air. She appears thin with a normal steady gait. Alert and oriented ×4. No acute distress noted. Perla bilat. Sclera white. Conjunctiva moist and pink. Ears with minimal cerumen bilaterally. Tympanic membranes visualized pearly gray bilaterally. Her nose without drainage. Her turbinates moist and pink bilaterally. Her oral mucosa was also moist and pink. All of her teeth were present. Tongue moist and pink as well. No postnasal drainage noted. No redness or erythema to her throat. And her tonsils were visualized but not swollen. Her lung sounds are clear to auscultation bilaterally with no adventitious breath sounds. Her O2 sat was 99% on room air. S1 and S2 was noted with no gallops or murmurs, no thrills. Abdomen soft and non-tender with bowel sounds ×4 quadrants active. No liver or spleen enlargement noted, and no bruise noted. Her vaginal exam did show thin, watery, foul-smelling discharge. Her cervix was pink with no erythema. Her labia majora and vaginal opening did have some slight erythema. With her stressors in life, the major stressor she has right now is the physiological issues she's having with this vaginal discharge and the foul odor. They could reach her lines of resistance according to the Newman model, because it is causing her not only mental stress, but it is a physical factor in her health, and it's upsetting to her having this condition right now. She also has a physiological stressor, but a positive stressor, because she has good family support and good support from her friends. They support her flexible line of defense, and she seems overall healthy and happy in her life. And she also has another positive stressor in her life, and that is her spirituality. She does have a relationship with God, and she states that it plays an important part in her life, and that is supportive of her flexible line of defense. She is involved with her spirituality, and it really means a lot to her. As far as her diagnosis goes, the main diagnosis for bacterial vaginosis, she was positive with the KOH test. She did have the thin, white, watery vaginal discharge with a foul odor present. The negative data, she does deny sexual activity. She reports that she has not been sexually active for the last year. Before the vaginal exam, one of the differential diagnoses I came up with was cervicitis, thinking that maybe the discharge was coming from her cervix. But upon vaginal exam, she did not have discharge from her cervix, and there was no redness or swelling or anything else going on. And I also thought with the differential diagnosis before her vaginal exam that maybe she had a foreign body in her vagina, but there was no foreign body present on the vaginal exam, although she did have the positive indicators of a foul odor and vaginal discharge. The interventions that we implemented, we encouraged her to increase her fluid intake, and that's a tertiary intervention per Dunphy et al. The role is the teaching and coaching function per Tracy and O'Grady. We also discussed personal hygiene, using mild soap and water to clean, and using fragrance-free soaps when cleaning. It's also a tertiary intervention according to Dunphy et al. And the role is teaching and coaching function according to Tracy and O'Grady. We did prescribe metronidazole, 500 milligrams twice a day for 7 days orally. That's a tertiary intervention as well, according to Dunphy et al. The role is diagnostic and patient monitoring function, according to Tracy and O'Grady. And we also prescribed metronidazole, the topical cream, a thin layer to the affected areas. PRN is needed. That's also a tertiary intervention, according to Dunphy et al. And the role would be, again, diagnostic and patient monitoring, according to Tracy and O'Grady. The client goals were to be symptom-free, and I think if she practices the good hygiene, using mild soaps that are fragrance-free and water to clean, increasing her fluid intake, and taking the medication as prescribed, she will have symptom relief within a few days, with complete symptom relief in a week. We did encourage her to call the clinic if there were an increase in symptoms or if symptoms did not resolve within the week. We also encouraged her to discuss birth control, but she did say that she was celibate. She was not ready to discuss that with us yet. So we did plan for our next appointment to, again, discuss birth control, just in case anything were to happen. She does plan to remain celibate till marriage, but I did want to discuss that with her just to let her know. She did express that she was not ready for any more children, so I just wanted to let her know that we were there for her for that as well. As far as the evaluation goes, I believe if she takes these medications as prescribed and use the PRN medications as needed, again, she'll have full symptom relief within a week. We did instruct her to call the clinic if symptoms got any worse or if she didn't get any better after a week. And if they don't, we will refer her to the gynecology to discuss any other issues she may be having. Her STD panel was negative, and again, she reported no sexual activity, so she would definitely need a referral to gynecology. She is able to care for herself, so I believe that if she follows this plan, she will be successful, and she will, her treatment will be successful with no additional problems. Thank you.